everybody. I'm Dr. Sally Foote and welcome to my Facebook Live. Today I'm going to be demonstrating and reviewing this product. It is called the Calm and Cozy Cat Wrap. It's kind of this combination of what we would normally call the cat bag, that, kind of a sack that goes around the cat's body and they're zipped up in. But it's made of fleece and it has these extra wraps that go around to kind of wrap and swaddle the body. And then especially for veterinarians and veterinary staff, which is great, you have these various, Velcroed spots that you can open up. And I'm going to show you here on Banks and listen to the heart and lungs, or undo one of the flaps, say here, or pulling the leg out for blood draw, or even down here when we have, I'll show you, when we have the cat in there, that we might be able to do a cystocentesis. So there's a lot of ways you can have access to the points we need to have on the body for doing blood draw, palpation, or examination, and even diagnostic techniques, while not having to unwrap the cat, and the cat is staying wrapped in a comfortable manner. This, like I said, it's made out of fleece. It's really very durable. The company sent this to me. I'm not paid for them to do this review. I just thought it'd be a good opportunity to do it. It has this, you'll see when I put it on Banks, this Velcro band here first goes around the neck, and we'll have him kind of sitting or laying in here. And then it's a separating zipper at the top, kind of like what you might have on a coat. So you will have to put the end of the zipper in there to start it up. You really do need to make this best for the cat, you are going to have it open, like so, laying flat on the table or maybe the floor, to make it easiest for the cat to get them in here. And that's really a big point. We want to make this easy, not rushed, and not forceful on the cat. Because it doesn't matter what kind of a tool you're using for calming, if you're trying to push the cat into it or make the cat go into it, then you're now making it stressful for them. I think a couple things also to note, and we'll go as I'm putting Binks in this, will be what is the cat's response as you are bundling them up. Because you don't have to, necessarily swaddle up all the sides on this if the cat really doesn't like that close of a swaddling, and still have the advantage of, a quick way to encase the cat that is not so difficult on the cat or you, to help get the cat in position and, work with the cat that you have. Now, a few other tips that are extremely, as I said, as part of my top 5 low stress handling techniques of cats. Always have either a pad on the table, like a yoga mat, a bath mat, or a towel. And at home, you may find a place where you're always going to, do treatment or care for your cat, make it nice. You're going to put a towel down on top of there, again, a bath mat. And at times when you're not having to do treatment on your cat, you're going to invite them up there to have a treat or playtime, so it's not always associated with care. But for those of you who are veterinary professionals, make sure your exam table has a towel on it, and of course it's sprayed with Feel Away. I have sprayed some of the Feel Away pheromone spray on the little jacket and on myself. Now, the instructions do, I'm going to say it, the instructions do talk about holding the cat by the nape of the neck. We know that means scruffing. We're not going to scruff a cat to put them into this tool, into this wrap. So, but sometimes, the cat may be a cat who's going to jump quickly or swat quickly, and you need to quickly get them in this because they are very reactive. So how do we securely have a hold on the cat and not have a risk of getting bitten or the cat escaping? Well, that's where we're going to use the cowl technique. So before we let the kitty out of the carrier, we're prepared. We have a wrap like this open on the table. You've sprayed it ahead of time with the Feel Away spray. You're going to have a chip clip for the cowl wrap, not the cat. And we're going to have, this is just a regular standard pillowcase, okay? And if those of you who have seen my YouTube video, the Scruff Substitute, we roll this up, so have this ready ahead of time in a roll, because we're going to have this to quickly wrap around his head and twist it together, and then we use the chip clip to hold the ends together. And this is what gives you the anchor point like a scruff without pinching his neck. Because remember that scruffing creates pain, and that's why cats hate hands. We want to make this whole experience of handling him positive, especially for cats who may be in pain, cats who are sick, cats who react very quickly to touch, even if they are on pre-medication. Okay, so I would have, and that's why I'm wearing my lab coat today, is because for the doctors and the handlers, you need to have your pockets to have these things handy with you, you know. So I'm going to put my little feel away there, my chip clip, I'm going to keep clipped on my pocket, and I have the cowl wrap right here by my side. Now another thing, when we take the cats out of the carrier, do not reach in the carrier. If a cat might need the wrap, he's probably sitting in the back half of the carrier, he's hiding in the carrier. So we do our little slow dump truck technique. Now Banks likes to come out, so you may not be the best one to show, but you're going to gently lift the back end like a dump truck. There you go. And just put your hand on the cat. Now he is wearing a collar, so I'm only holding his little collar. You can keep your hand there, and I'm going to set the carrier down. So this is where you have your cowl handy, and you have it quickly come around the head and neck. Okay? Twist the two ends together and take your chip clip on the fabric. Put that together there. There you go. Okay, so this is how I can do this as one person. So now I have the anchor point like a scruff without scruffing him. You can see he's already laying down on the wrap. He likes laying on the wrap. And I've also have a little bit of canned food here to make it even more rewarding for him. Now, even if you have a cat who's coming in for surgery or blood work fasting, they can have a small amount of the cat food, like just enough to smear on the plate to be able to be rewarded for being here. So I want to go ahead and give him some just sitting like this on the wrap. I want him to make that positive association with the wrap and being here. So I'm going to sneak this a little bit forward. So now to get the wrap on, we're going to come up and around his head, and you can get this, whoopsie, right in front of, okay, you saw that I got that in front of the cowl, so I'm imagining he's a cat who might be difficult to handle. And now I'm going to take the cowl off because I don't need it. There we go. There. And again, then with this tool, this cat wrap, take either side to hold him like so as you position his body. This is what will help prevent him from swatting with his arms or wiggling around in it too much. We want the wrap to kind of come up around him quickly, somewhat quickly. So we first go around the neck. Now I'm going to take the two ends, and you see how I've got my arm, I have it positioned against his body, and it's my forearm that's helping to prevent him from jumping or going forward, and this prevents him from going forward. So it's helping him to stay on the table. Now I'm going to go ahead and start the zipper, and with this part, I would just lift you. Yeah, I know, you worked yourself around a little bit. And then zip. Just work, I think working the zipper down is best. And then we may lift your little tush to get your back end in. Yes, I know. And their paws, the paws go down in the front, and pretty much they'll put them down there on their own. Now his little tail is out here, so I'm gonna help tuck it in. I know, okay, there you go. Okay, so now the front, so you can see he's pretty well encased already. Now, a lot of cats like the added, snugging, if you will, of taking these slide wraps and coming around and then coming around again. Okay, so now he's bundled up. Now, these 2 points here, this comes open, I now have a little window. So to listen to his heart and lungs, I can put my stethoscope on, and I can, if I was concerned about bite risk from his head because it's exposed, I'm sorry, this is not a thick towel, but I could hold his head like so, roll him to the side, and slip my stethoscope in to listen to his heart and lungs. Now, Banks does not like to have his head covered very much, so that's part of why he's growling like that. Now, some of the other things that are nice about this product is we have points here that we can open up for a lumbar injection. when we can roll you laterally, and now we can undo this flap, and he can, yeah, I know, where's your leg? Here it is. We can pull his little leg out. Yep, we can pull his leg out for that. For an ultrasound, he could be positioned like so. Yep, I know. And we can undo this flap here to be down on his abdomen for cystocentesis or for ultrasound. Okay, there. So for a lot of practices have liked using these because it can be a lot simpler than training your staff to really learn how to do the complete towel wrap. I think it also can be helpful for the cats who like to have their head out. Now, Binks is one like that. He does not like his head covered. He doesn't like a lot of the tight swaddling in a towel. But let's just say if he was a cat that a less experienced staff person needed to, say, examine or get a blood drawn on him, or maybe they had been bitten before, and now they need to examine him and they wanted to use some kind of a wrap. This would be something that actually you can see he's pretty calm in it because it's kind of loose fitting for him, and that's what he likes. It's also relatively easy to use. So I think this product is a really good product. And of course, when we're all done, we can put our kitty back in the carrier. Thank you. And the way we would do that is unzip the back, point him toward his carrier, of course. And you always get some good reason to go in there. So throw his little food in there. And away you go. Go in. You want to go in? There you go. Okay. Now for home use, I would definitely recommend keeping this out, laying it open to be like a cat bed. The more this is scented with that cat's own scent, the better they're going to like laying in it or being wrapped up in it. At home, of course, you may not need to do as many of the different points as we need as a veterinarian yet. If you, say, have a diabetic cat that's difficult to give the injection to, you could quickly wrap them in this. You could just unzip the neck a little bit if you're going to give the injection over the back of the neck here, or sub-Q fluids that way. If, or for clipping nails, you can position the leg out through these different spots here, and also up here for the front legs for nail clipping, and that can be a lot easier for the cat and easier for you in reducing bite risk and that. The wrap is, I believe, $89. You can buy it online at, let me see the website here, calmcozycat.com. I did see that it's slightly less if you buy 3 of them at a time and you get free shipping. I think that especially for a lot of our veterinary assistants and veterinary technicians who have not had the advantage of really learning more of the, specifically exactly how to do the low stress handling towel wrapping techniques, and how to stop scruffing, and how to get their hands off the cat. This can be a really good, helpful tool to help them, use this, have less bite risk on the staff, be much better for the cats, and that's how they can really transition over to more of this low stress handling, fear-free handling. For veterinarians or technicians who may have to work alone, and a lot of our practices now have had to go to more limited staffing, and team staffing during the curbside care, which is still present in most of our practices. So we have fewer people to help each other, and we don't want 3 people, all together around a treatment table. So having the cat in the wrap like this can help someone, a veterinarian or veterinary technician, assistant, or shelter care worker, or even somebody who has a cat owner, work alone. You could swaddle your cat up in this and be able to do a lot of the treatment for your cat, treating the ears, treating the eyes, checking the teeth, injection, sub-Q fluids, nails. So I think this is a really handy tool. It's durable, and I think it's well worth the money. So thank you very much. I appreciate everybody tuning in. Remember, November 15th, Sunday, November 15th, I will be presenting 5 hours of behavior education through the Illinois State Veterinary Medical Association online convention this year. The 1-hour feline handling lab will be live. Okay, that's going to be truly live streamed. I will be here at the Bella Behavior Education Center, Learning Center, with another low-stress handling certified veterinary technician and some cats, and we are going to go through some of the different handling techniques, low-stress handling techniques for cats, like how to wrap them in the towel, how to use the cowl hold, how to position them, how to do the in-carrier exam, and we can also go over this again. So I hope you can attend that. To find out, go to isvma.org, and you can go under the events. I believe even on the front page of the website now they have the registration for the conference. And the really, I think just about all of the states in the United States have reciprocity with continuing education from Illinois. So thank you very much. Make sure you sign up for my YouTube channel. I'm going to put this up on my YouTube channel as well. Have a great week, and thank you.